Well, as you know, the coronavirus has had a huge impact on all of us, mentally as well. Not only for adults, but life has changed dramatically for children. To this day, children are still asking, why has this happened? Why them? Kholofelo Mphahlele from Section 27 has more on this. Kholofelo, good afternoon to you. We're only, I think, beginning to come to terms as adults with the mental impact of what's happened over the last 2 or 3 years. I don't know if anyone's really, if we've thought enough about what's happening with children.
Good afternoon, Stephen, and good afternoon to the viewers. So it's something that I don't think many adults have thought about, whether skilled caregivers or teachers. It's something that I've actually had to relook myself because I've got a 5-year-old. So when COVID started, I looked at her, and now 2 years later, I looked at the difference. And the mental health of kids has really taken a knock. If you look at their socialization, they're very isolated. We had to social distance. That was to keep them safe, but now they are distant from communities, they're distant from their friends, they're distant from families. Their development is also a bit slower. If you look at babies in particular as well, they're slower to speak because we are always wearing masks, so they can't see what words that we're articulating. So it's a rip-on effect that I wanted to look at specifically for children and those under 10 and 5 years old.
One of the things that's very scary for a child is to see their parents in distress. And I mean, I'm a parent, I have 2 children. You try and protect your children from your own stress. During COVID, so many people not able to bring enough food home for their children. Very difficult to hide that from your child.
It is. They have felt not only the mental impact, but the financial impact, the social impact. I mean, if they were used to getting certain treats, they are now unable to because of the financial impact. Some parents weren't working. Some parents have been laid off. So all that stress that you are carrying as an adult, thinking they don't see, they sense it, they see it. They take it to school when they go on those selected days. They can't concentrate because they're thinking our home situation is falling apart. So it's really had a big effect on also children passing. Some have just been let through, but without actually learning because they are so stressed themselves. No one has asked them, how are you doing? How can we help you? Do you need counseling?
How do we protect our children? I mean, where do we start? Do we start by talking to them about it? I think some people are worried that the more you talk about it, the worse it can sometimes get.
I think you do need to talk to them about it. One of the questions that I was constantly asked by my daughter was, when is this going to be over? And what is actually COVID? And the simplest explanation I could find was, it's a bad flu. I had no other words to say, but it was a bad flu and we need to wash our hands and sanitize and do a social distance. And that was the simplest way I could put it to her. But you do need to talk to them about what's going on because unlike adults, they're not proficient enough and they can't understand what is going on through reading, through stats. So you do have to talk to them, explain to them what's going on. And this is our new normal, which could be with us for quite a long time. So it's best to have an open conversation about them. But the other thing, Stephen, that you need to take into account, especially as a parent or as a caregiver or an early childhood development teacher, is that you need to first get a hold of your own anxieties as a parent. You can't talk to someone or your child to say that you need to be calm if you are not calm. So you need to get a hold of your own anxieties and calm yourself and find yourself in a situation, whether it's a financial one, a social one, or you are battling with this, how do I talk to my children about COVID? So you really need to get a hold of your own fears and then talk to them. And then also we need to give your ECD practitioners, your teachers, more skills, more capacity to deal with children that are dealing with these mental issues.